They say a picture is worth 1,000 words. Well, a number is worth a lot, too. I love numbers. And today, the number from the Congressional Budget Office that this health insurance reform legislation will save $138 billion in the first 10 years and $1.2 trillion in the second 10 years speaks very eloquently to the deficit reduction that is in our package.
Well, what will this bill do to help us? It will prohibit insurance companies from raising our premiums if an employee gets ill and actually has to use the insurance. And probably most importantly for me as a small business owner, beginning this year, I'll receive tax credits of up to 35% to help cover the cost of these premiums. This will help me continue to provide health insurance for my employees.
If we pass health insurance reform, as we will on Sunday, those tax credits will begin to kick in immediately. But if reform fails, the trend of shrinking coverage will continue. According to the Robert Woods Johnson Foundation, the number of small business employees who can buy plans through work will be cut nearly in half by 2020, from 41% today to 23% in 10 years. Now, what does that speak to? People who say, look, I've got insurance now. Why am I concerned about this bill? They're concerned about the bill because they're losing it at a rapid rate because the businesses for whom they work can't keep it.
Agliophobia is a fear of pain. Iatrophobia is a fear of doctors. But I've yet to find a word that defines my biggest fear, fear of pre-existing conditions. Although we pay several $100s a month for access to quality care, I'm afraid to use it. I often ignore minor aches and pains. I've held off on some scheduled blood tests and exams, and I worry that my attempt to save a few dollars now could cost me dearly in the future if minor problems spiral into larger ones. But ironically, as long as people with pre-existing conditions can be denied coverage, spending money on doctor visits and tests to solve problems early on could actually cost more dearly in the future.
It's time to bring an end to discrimination based on pre-existing conditions. It's time to bring an end to rescissions or dropping coverage when a person gets a catastrophic illness. And it's time to bring an end to the fear that many Americans have that if they lose their job or they change jobs, they cannot get health coverage. It's time to do what generations before us could not accomplish. It's time to pass health insurance reform.
But unfortunately, along with over 3 million other seniors, I am in what is known as the Medicare donut hole. For several months of the year, I have to pay full price for my prescriptions, even though I'm still paying my Medicare premiums. In other words, I pay the money but get nothing in return. The health care bill will help seniors like me who struggle every day to afford the prescriptions they must have. Retirees all across the country desperately need this bill to pass right away.
There's no real option in the private market for people with pre-existing conditions. So I urge strongly that Congress make the humane choice for our country and pass this health care reform bill. Plain and simple, it's a broken system, and it continues to leave a trail of families whose finances have been decimated by the system.
Do you know what our members are concerned about? They're concerned about what our guests are. They're concerned about the process which finds their policies being rescinded. They're concerned about the process that finds their policies canceled because of pre-existing conditions, or when found in a second, their policies rated or then actually taken away. Stories that lying on a gurney heading into the hospital, you have your policy revoked. That's what our members are responding to, and that's what Americans are responding to all across the country, and why this is so important.